All right, so first things first, what is Candida? Candida is essentially a yeast. So you kind of have this big branch, this big umbrella of fungus, and under that umbrella you have yeast and you have mold and things like that. And Candida is an important one, right? There's the common one that you guys typically hear is like Candida albicans. That's the one that you typically see overgrown in the stomach. You have Candida krusei, Rhodotorula candida. There's different species of Candida, different brothers and sisters and cousins and such, but it's all under that big umbrella. So when we talk about Candida overgrowth, that's really what we're referring to here. So in general, Candida overgrowth, we have naturally going to have some Candida in your stomach or in your intestinal tract, small intestine. Typically, it's, throughout your life, there's going to be some there, right? It's the overgrowth we're talking about. So when we talk about Candida, it's not a zero-sum game. You have none, now you have some. It's, hey, there's some, but it's at a lower level. Your body has control over it. It's pretty low. It's not creating symptoms, and it's not creating intestinal health issues. It's not creating motility issues. It's just there, but at a normal, lower level. And you have other beneficial flora. Your bacteroides and firmicutes are at healthy levels. And your beneficial bacteria like bifidobacter and lactobacillus are also at healthy levels. And so we like to use stool testing to see what these levels look like. We can test it, and we can kind of use a standard deviation to see where that sits based on normal, based on the typical population. So we can look at commensal bacteria. This is like your bacteroides, your firmicutes, right? And then within that, there's going to be E. coli and Enterobacter, a whole bunch of other normal bacteria that we can see where they sit on average. And then we can see beneficial bacteria like bifidobacter and lactobacillus. We can see those. And then we can look at dysbiotic bacteria. That's going to be like your gram-negative bacteria. This is going to be like your Citrobacter, your Klebsiella, your Proteus, your Morganella, your Pseudomonas, right? These are your dysbiotic gram-negative bacteria. So now getting back to Candida, when we find Candida overgrown, we typically are going to see it with other types of stressors in the gut. You may see it with H. pylori. It's super common to see with H. pylori. You may see it with other types of SIBO bacteria. So we talked about Klebsiella or Citrobacter or Morganella. These are other bacteria that you could say maybe they would fall under a SIBO diagnosis, right? SIBO is small intestinal bacterial overgrowth. That's typically going to be diagnosed with breath testing. We're going to swallow a lactulose solution. You're going to blow into a bag for about 2 to 3 hours. Then you're going to look for these methane and hydrogen gases, and you're going to infer that if they're high, that there's bacteria producing those gases. That's why that gas is present, and that's why that SIBO is there. So getting back to SIFO, or small intestinal fungal overgrowth, we can see that as well. Now, typically, good ways to see fungal overgrowth, you're going to see it either in the stool. You can see it on a stool test. It's a little bit harder. It may not reach a positive threshold, but if it's there, it's hard to pick up. It's harder to culture. So if it's there, it's a problem. We may see it on an organic acid test. We may look at diarabinose or tartaric acid or oxyglutaric. These are different Candida metabolites. We see it on that too. That may give us a really good indication of what's happening on the Candida. So we have it on that side of the fence. I would say we can also run blood too. You can run Candida IgG, IgA, IgM antibodies. That's helpful to look at. If someone has significant issues, you may see an immune response to it. Again, that's more indirect, right? You're looking for an immune response. Stool, you're looking to culture it in the stool and actually see it in the stool. And then you have it in the urine, which are metabolites in the urine. Sometimes Candida is hard to pick up in the stool, and you may need more of a systemic marker like the urine, and you may grab that like diarabinose or tartaric acid to see what is going on. So that's super helpful. So that's what we're going to look at diagnostically on the testing side.